Okay, so I think this is live. We'll find out here briefly, but this is my first time doing this, so this is actually quite interesting to me, and a new space that I have not ventured into, mostly because I have been timid, or another word I guess would be shy, but I don't know if that's the case. More, I just don't want to be judged by everybody. So, anyway, so I am here. My name is Eric, and I am a HealthShare expert. I've been doing health sharing communities or helping represent HealthShare communities for the last 6 years, since 2019, and they've become really popular over the last few years. But what I do generally is I share, what HealthShare is. I explain different scenarios that people have gone through when they've used it, how they've used it, all that fun stuff. And anyway, I just hope this is working. I just have no way to tell. So let me do a quick check on this just to make sure, because I don't know if I'm supposed to hit record or just hit stream. So I think I'm just supposed to hit stream. So let me see here. Um, Give me 1 second here. Oh yeah, there it is. Okay. What is HealthShare? It is live. This is fun. This is fun. I think 2026 is going to be a fun year. So I'm going to go through a presentation that I've created, and I've also, it'll be here for you when you want it, when you need it. If you need more information later down the road after you've watched this, you can visit me at whatishealthcare.com. It's basically, I've created a source for all your alternative healthcare plans and programs, just kind of help people understand what that's about. But HealthShare fits into that puzzle very well. So I'm going to go ahead and share that with you right now. Looks like everything's working on my end. So we're going to go, we're going to proceed. Let's charge forward. Let's do this. So, what is the problem with today and, the healthcare system? Well, I'm sure this is a conversation in itself. It could go on for hours and hours, but I just want to highlight a few things, right? So obviously premiums are uh, going up. If you haven't received your updated rates already, you will, or maybe you have, and you have sticker shock, and you're like, oh, okay, how can we do this? Are we just going to do it? We'll just do it because we use it, or we don't use it. I don't know what your situation is, but premiums are out of control, right? Deductibles are unreasonably high. I mean, people are paying $7,000, $10,000 before the insurance even steps in, and it's just a ridiculous amount of money. Also, the network system, right? So, what kind, everybody's that, a lot of people ask me, they're like, hey, who's your in network, or am I out of network, or do you have a network? And so I'll explain a little bit more about that later, but the network system is just a composite list of every doctor and provider that's out there. It doesn't necessarily mean that they're good, right? It's just a list. And it's a list that says, oh, we've agreed to a set price, even though insurances usually negotiate and try to get more. There's also, issues with claims, claim game, denials, delays, all that fun stuff. And nobody wants to worry about that kind of stuff. And then also employers are feeling the squeeze, employees are feeling the squeeze. It's getting tougher and harder for employers to want to provide benefits because it's just so outrageously expensive. I have a good friend who has just turned all of his employees over to the marketplace. Go do what you want. I'm not paying a dime. I'm not worried about it. And that's the route that a lot of employers are going. But if you're in a business where you want to retain talent, or you want people to stick around, and you want to attract better talent, then you need to have a better solution. And I do know of organizations that do offer, health sharing as part of their package for employees, and they list it very clearly on the employee the job site, the job boards that they've created, they list out those benefits and say, oh, we offer HealthShare, we offer these other benefits that go along with HealthShare to make it a successful plan. So the the purpose of this video today is basically to talk about the alternative, right? The alternative really is health share, right? Health sharing. What is a health share? How long has it been around? It's been around for over 30 years. Started in the Amish community as a religious ministry, helping a pastor who had gotten injured. And so it's now today. It's more of the concept is it's a nonprofit community that's designed to share in major medical expenses directly without the insurance, right, being involved. And so why does it work? What makes it work? So, the fact that it has lower costs is one reason. It's flexible. You can go where you want. You can still choose who you want to go visit. It's community driven, so it's not driven by stakeholders or people who need to maximize profits and revenue. This is all in it for the members of the community. And it's important to know or to note, what HealthShare is not, right? Again, it's not insurance. HealthShare is not insurance in any way, right? So that's nice because you know immediately that they're not going to have the same interests, right? And so it's not insurance. It doesn't want to look like insurance, doesn't want to act like insurance. It's also not ACA compliant. And that's a good thing because people right now, the discussion is, well, they need to renew the ACA subsidies and everything, all of this stuff, right, about ACA. And, in itself, health sharing does not meet any of the ACA requirements, but a lot of people don't know. And in fact, this happened to me just this week. This person I was talking didn't even know that ACA was lifted. Like it's not a requirement federally anymore. There are some states that do require a health plan for if you live in that state, and they still consider that ACA compliance. But by itself, HealthShare is not going to meet any type of ACA requirements in those 5 states where there's still requirements, right? Also, if you're an employer and you have over 50 employees, you do have some requirements that are instituted federally that you have to apply. You have to offer some sort of affordable care to your employees, right? And it has to be something that a majority has to take. And so you have some, enrollment numbers that you have to meet. So again, though, HealthShare, it's not gonna fit that bill, right? Also, HealthShare is not a guarantee or a contract, right? Because that's what insurance does. Insurance is a guarantee and it is a signed contract between two parties to manage that risk. HealthShare is not that type of guarantee. It doesn't have that same level of, legal bite to it, I guess you could say. But that's what makes it a health share. If it did, it would be insurance, and we don't want it to be insurance, right? And then also, when you make a contribution to the health share every month, that is not a tax deductible deduction for you or your business, not tax deductible, um, because you're the beneficiary, right? That's the main reason. So who can join a health share, right? So a lot of people wonder, oh, can I join? And and the answer is yes. Ages 18 to 64 is the age range that we're looking for membership at a health share. Once you hit 65, when you turn 65, that then becomes your opportunity to join Medicare. But anybody between the ages 18 and 64 can join. Kids can join as part of their family up to age 26. So when you turn 26, then you jump off. There's no medical underwriting involved. We're not asking for, blood work or any type of information or history related to your health and wellness. It's great for individuals. Like I have a lot of individuals who sign up who maybe their husband's now on Medicare and they just need 4 or 5 years of something for themselves. This is a great solution for that. If you're young, I mean, it's really affordable. It gets down as low as $84 a month for catastrophic support. right? And so that kind of makes sense for a lot of people who are really young, entrepreneurs as well, as I mentioned earlier. Families, it's a great solution for families. I have a family. I have four kids at home, and we have it for our family. Entrepreneurs, I'm also very entrepreneurial. But if there's an entrepreneur out there that's looking for some sort of plan or something to help them, then this is a great solution for that as well. Employers can offer it to their employees as a benefit, and there's no minimums required, which is really nice that you don't have to worry about any type of minimum uh, participation. So how does it work, right? So how does HealthShare work? So HealthShare basically, when you join the HealthShare, you choose what's called an IUA. IUA stands for the initial unshareable amount, right? And you pay that initial unshareable amount when you have a medical need. And so I'll give some examples. If somebody hurt their knee and needed to see a doctor, they would schedule an appointment with a doctor. Then they would schedule an appointment with maybe X-rays or MRIs, or take that information back to the osteopath. By then, sometimes you could be about $1,000 out of pocket for all of that care. So you pay what's your portion of a medical need, right? So, in the world of insurance, it's a deductible, but here we don't call it that. We call it a initial unshareable amount, out of pocket amount, and it's based on the need. So it's very different than a deductible. Deductibles accumulate over a 1 year period. IUA is per medical need, right? And so you submit your medical need request online to the HealthShare, and once that's been reviewed and approved, and they've seen that you've met your portion out of pocket, then the community would share in the rest of that medical expense. And so it's better than a deductible because it's paid once per medical event. There are three options you can choose from. You can choose 1250 per medical need, or 2500 out of pocket, or 5000. So this is the amount that you're saying I'm willing to pay out of pocket before the health share kicks in to support, right? Follow-ups are included in this IUA. So anything that comes after you've met your 1250 amount, anything else that's required for you to get to healthy, better, or whatever it is that you need, that would be included in the IUA. Just want to test my audio here real quick. Again, this is my first time live broadcasting, so I just want to make sure everything is working okay. Testing, testing. Yep, it looks like it's working. Okay, so going back to our conversation here, give me 1 second. Okay. Um, sorry. Okay, great. So, and then what's really nice, so follow-ups are included, as I mentioned. What's really nice is that the health share has made it so that a household is only responsible for 3 IUAs in a 12-month period. So the first three are going to be your responsibility. Anything after that, as long as it's over a certain threshold of, I believe it's $500, then the health share says, hey, it's a true medical need. We will support the rest. They'll pay for the rest, basically. And so what counts as a shareable need? Now, I've got lots of examples, but just to summarize, medical need requests would include any type of emergency care, right? An ambulance ride, life flight, anything that's an accident related. And typically if you're when somebody says accident, they might think auto accident. Typically auto accidents or any of those other kind of insurable accidents, the insurance would come in first position, and then the health share would help support. But we want to make sure that you are being taken care of, that you survive. Obviously, that's the first and most important thing. So hospitalizations as well, any type of surgeries, any serious illness, and we also do maternity. So if you are young and you have a family, you're starting a family, or you want to add more kids to the family, then you just need to be a member of the health share 6 months before. And there's some other rules related to this, but I have a slide that we'll talk about that in a minute. And so here's what's not shareable, right? So say I'm very cautious about my blood and my health and wellness, and I decide I want to go get, my blood work done every month. If I'm doing that, that's a routine type of care. It's not related to any medical need per se. Then what happens is that would be viewed as just routine care, and that's out of pocket. It's on me. So routine care can be out of pocket, but if it doesn't lead to a major medical need, then it's just going to be an out of pocket expense. And so I can go where I want and use who I want for that type of service. What's also not shareable, dental or vision care is not shareable with the community. Any elective procedures are not going to be shareable typically with the community. And then we do have some conditions related to pre-membership conditions, right? So we have what's called our phase-in schedule. So we don't turn anybody away. We want everybody to come join, participate, be a part of our community. And so what we do instead of turning people away or saying no, you can't join because you have existing conditions, we have this phase-in period just related to that existing condition. So again, it's any type of sign, symptom, treatment, or medication related to an existing medical need. So again, the example of like my knee, if I hurt my knee and now I'm joining the HealthShare and I'm like, oh, I need to have surgery, the health share is going to say, well, the first 12 months is a waiting period, right? And mostly this is done because we didn't want people coming to join the health share community, taking advantage of the community, and then leaving the community. We want people to come and stay, come be a part of our health share, come be a part of our community as long as you can, right? And so in the first year, again, 12-month waiting period. Second year, the door opens to 25,000, so we'll share up to $25,000. The third year, up to 50, and then fourth year and on, it's $125,000 worth of sharing, which is more than enough to cover most accidental type, incidents or surgeries or even, things like that that have existed prior to your joining, right? Now, there are some exceptions, and I didn't list that here, but that if you have high blood pressure or diabetes or are uh, high cholesterol, if you're taking medication, you're maintaining it, those will be overlooked. Those will not be considered pre-existing or pre-membership conditions, as we call them. And so if you have any of that, you can still be a part of the member. And if anything results from those, it would be shareable completely with the community. So now there's this concept of direct primary care, DPC, right? So DPC plus a health share, right? What does that mean? Or what does that look like? So direct primary care is going to be your routine care. It's going to be anything that's related to, and so we were talking about routine just a second ago, but this is a separate relationship with a doctor who comes in and becomes your doctor, right? They're there to take care of you, to help with anything that comes up, right? And then the health share is there to handle anything that's catastrophic in costs, right? Costs mostly related to cost because your doctor or the care provider that you're using will help you manage and direct, and you get to manage and direct where you want to get that care and what kind of care you want to get, right? And so together you have this complete puzzle, this complete system of care. And the HealthShare also offers a few additional services that I'll go through that help enhance your membership with the HealthShare. And so one of those benefits or add-ons that you can add to the HealthShare have to do with preventive care, right? So what is preventive care? Preventive is obviously clearly stated as it states there, something that you do to prevent any future illness or service or injury, right? And so what do we do for our members with this preventive care add-on? This is an add-on because you can get it with the direct membership or you can add it into your essential membership. But you get an annual provider visit with your membership. So it's valued at $175 per member, and it's something that you can take advantage every year, and it's available to you immediately, right? Also, we offer well child visits for young families and kids, right? We also have adult preventive screenings as well. So if you need a colorectal cancer screening, you're at that age, or if you want to do mammograms, and you're at that age, then those are available to you after 6 months of having this particular preventive service in the membership. So you just wait 6 months, then you have access to those. And there's no IUA required in order to utilize those services, right? And we do have some guidelines that go through that on our website if you're interested at whatishealthcare.com. We also offer virtual care. So this virtual care gives you access to on-demand providers. We can help with prescription refills. We offer mental health components as well. It's also included in the direct membership, but it's an add-on to your essential membership. But it's very easy and quick to use. My wife loves it because when our kids in the middle of the night might have an earache or might have a fever, we can get support quickly from a provider who's going to help answer our questions. Now, we also offer a prescription benefit too. So if you are currently on a medication or think that you might be starting a medication, this might be a benefit you want to add in as well. And this benefit gives you access to again, prescription drugs, both local, here, but we can also source from overseas and have it delivered to your home, or you can pick it up locally. And I mentioned maternity. Maternity is a big deal, right? If you're young and you're starting a family, um, it only costs a minimum of $2,500 out of pocket for a child, for a baby. And if you had insurance with an insurance company, you'd have to pay for the first 5,000 or 10,000 for a family, right? And so this is 2,500 for per birth, but you have to be a member 6 months, as I mentioned. You have to be a member of the HealthShare 6 months, then conception occurs, and then the HealthShare will pay for your prenatal, delivery, postnatal, hospitalization, OBGYN, C-section if necessary, and home birth. So a lot of great options there for maternity care. And so this is a quick overview of the membership. So as I mentioned, we have the essential membership. If you scan this QR code, it'll take you to my website. It will show you where the pricing is, and you can actually take a look at what is available for you. But that again is the base level membership, right? And what's nice is that they peel those parts away. Maybe somebody doesn't need the prescription benefit, then you can keep that out of the plan and not pay as much, right? And so that base level membership includes a death benefit of up to $10,000 per adult and $3,500 for children. Has the base fund. So if you have any medical needs that come up, that's what you want to have, is that base level membership. And then the direct membership, if you want all of those services, you want all of those bullet points, the preventive care, the virtual care support, prescription benefit, then you're probably going to want to go with the direct membership. And so that is also available through this QR code. It'll take you right to the page. You can do a side-by-side comparison, and there's a link there. You can click on that link, and that will take you to our HealthShare partner. And so, and if you have any questions, you can always schedule a call with me as well on that same website. So why people choose HealthShare? Well, again, lower monthly costs, right? No annual lifetime caps, fast processing when it comes to processing medical needs, typically 5 to 8 business days. You still get to choose the freedom, you have the freedom to choose who you want to go visit. So you got the freedom of provider choice. And again, we're community based. We're not a large organization that's trying to make much money as possible to pay stakeholders and investors, right? So we're here for our members. And just a few more slides, but some frequently asked questions that I get is HealthShare the same as insurance? Well, quick answer, no, it's not. It's very different than insurance. HealthShare does not want to even be thought of as insurance. It does very different things, right? And so it's not the same. Is it ACA compliant? Well, by itself, HealthShare is not. If you're an employer and you are looking at maybe offering a HealthShare, I do offer other services that help businesses maintain compliance and also be able to offer vision, dental, and HSA accounts, health savings accounts, right? So if you're interested in HSA, but you have to have a minimum of 2 employees at least in order to take advantage of that. And medical needs are processed typically between 5 and 8 business days. So if you have any medical needs, how fast are they processed? That's how long. And as long as all the paperwork's been turned in, typically it gets handled quickly. So, and do I still pay out of pocket? So the IUA is what I consider your out of pocket cost, right? And so you want to make sure that you understand that you're responsible for those out of pocket expenses up to the $1,250 per medical need. If it's just a routine visit and nothing comes of it, it's just an out-of-pocket expense. An example of that, one of my kids tripped and cut her chin open at the swimming pool. We had to pay 500 for stitches. It didn't turn into a medical need because nothing was broken, no surgery was required. It was just $500 out of pocket, simple and taken care of on our own. And then let's see here. Let me close this off. There we go. So that's the out-of-pocket expense you would pay. You'd pay for that initial out-of-pocket. Does it replace insurance? That's entirely up to you. I would say it does for me. In my opinion, it does replace my insurance. I do not use insurance. I don't pay, for insurance for our family. I use the HealthShare and I use other tools like the telehealth, and preventive care services for our family. And does it work outside the US? It does. If you are traveling abroad and you have an injury and you're abroad, most likely you'll have to pay cash for that visit. But if it's over the $1,250 amount, then submit those receipts over to the health share. Make sure that they're translated. Make sure that they're itemized so that we can see what was done. Then they'll either reimburse you, or if you're still in the country and you need it, it's going to be a reimbursement type situation in that case because it's international, right? Um, let's see here. So if you're ready to create real healthcare freedom, if you really, really are curious about HealthShare, I've got a couple of websites you can visit. You can visit whatishealthcare.com. You can scan on that QR code. That will take you there. I also have a website called tryhealthshare.com, which puts you through and gives you another version of a video presentation that I've put together, along with some information to help you understand if it's a good fit for you. But whatishealthcare.com is where you can find me. You can schedule a call with me, and I'm happy to help you understand if this is a good fit for you. So thank you for your time. Thank you for the opportunity to share this with you. Health sharing has been a financial savings for us. It's been great for our company, great for family members who I know have used it. It's great for friends, great for a lot of people. So I think it's wonderful and it's a great solution. If you have any questions about health sharing, please reach out. Let me know. I'm happy to help. I look forward to serving and helping. So let me go jump over here real quick to this website and see if we've got any traction here. Okay, great. So, all right. Well, this is my first, and I hope to do this again more often, and maybe even bring more topics, bring more discussion around what is healthcare, and offer some other great services. So appreciate you. Thanks for being with me, and have a great rest of the day. And if you haven't already, this is all new to me. Click subscribe. You can comment, share this with your friends if you think that this might benefit them. I would love to get this reach out further. So again, thanks again, and I look forward to seeing you out there. Bye bye.